morning. First of all, I want to thank Sages for letting us present our research study, and I want to thank our mentors, Dr. Raul Rosenthal and Dr. Lomenzo. Nothing to disclose. So this is a visual abstract that summarizes what we'll be discussing today. We will be talking about the cardiovascular risk reduction using the Framingham risk score and the ASCVD score. We will be talking about how does the cardiovascular risk has an effect on weight loss, and we will be talking about the comorbidities resolutions. So we all know that obesity is intrinsically related to the pathogenesis and progression of cardiovascular disease, and we all know that nowadays weight loss surgery is standard of care for morbidly obese patients. In our previous study, we published regarding the reduction of the Framingham BMI score after rapid weight loss after sleeve gastrectomy. And what we found in this study is that after 1 year of rapid weight loss, there is a relative risk reduction of the cardiovascular risk of 35% in males and 38% in females. In this current study, our goal was to evaluate the association between this preoperative cardiovascular risk and weight loss. We want to determine the impact of bariatric surgery on the new score. This is a ASCVD score, atherosclerotic cardiovascular disease score. This is a new score published in 2013 by the American College of Cardiologists and the American Heart Association. And we want to assess the impact of bariatric surgery on high cardiovascular risk patients. So we retrospectively reviewed almost 3,000 patients. We included individuals from 30 to 74 years old without a cardiovascular disease of baseline. And we measured the Framingham BMI risk score and the atherosclerotic cardiovascular disease score. These are risk calculators that assess 10-year mortality from a cardiovascular disease. So we included 360 patients that met our criteria. There were patients in their mid-50s, early 50s, above BMI above 40s, and systolic blood pressure in prehypertensive ranges. We included mostly sleeve gastrectomies, Roux-en-Y gastric bypass, and others is 11%. And what we found is similarly like on our previous published studies, is that after 1 year, there is a relative risk reduction of 25% in the Framingham BMI score, and there is a 32% of a relative risk reduction in the female population. And what we still find is that the preoperative risk, as you can see here, is far higher than the ideal risk. Ideal risk meaning of a patient BMI less than 25 and without comorbidities, 3 times higher, and 3 times higher in female. And when we measured the ASCVD score, we found similar results. We found that there is a 32% relative risk reduction in males and 35% relative risk reduction in females. This is stating that regardless of the tool we use to measure the cardiovascular risk, bariatric surgery has an effect on the cardiovascular risk reduction. And all of these changes of the cardiovascular risk is due to not just to the BMI changes, but it's due to all the changes in the metabolic profile of the patients. As you can see here in red, in the red boxes, all these variables had a significant change after 1 year. And when we classified our severity of the Framingham risk score by severity, and we assessed weight loss, what we found, interestingly enough, is that our low-risk patients, they have a slightly increase on their risk, the cardiovascular risk. But when we assess our high-risk patients, we saw that there is a 35.5 relative risk reduction of their cardiovascular risk. So when we measured our estimated BMI loss at 1 year, we saw that low-risk patients, they lose about 70% of estimated BMIs compared to 65% of high-risk patients, meaning that high-risk patients, although they benefit the most from the cardiovascular risk standpoint, they lose 4.79 less estimated BMI loss in 1 year. And when we assess, using the linear regression, the preoperative cardiovascular risk and its relationship with the estimated BMI loss, we found that there is an inversely proportional relationship between Framingham risk score and the estimated BMI loss, meaning that for every 1 unit increase in the preoperative Framingham risk score, there is a decrease in the estimated BMI loss. And when we assess the preoperative ASCVD score, we found the same thing, that for every 1 unit increase in the ASCVD score, there is a decrease in the estimated BMI loss at 1 year follow-up. And to summarize, what we found is that, and this is a take-home message, that there is indeed a cardiovascular risk reduction using both formulas, the family and risk score, 29% average, and the ASCVD score, 34%. We know that high cardiovascular risk patients benefit the most from this bariatric surgery. Cardiovascular risk has an impact on weight loss. High cardiovascular risk patients lose less weight than estimated BMI loss. Less estimated BMIs than low-risk patients. And all of these changes is not only due to the weight loss pattern, but it's also due to the comorbidities resolutions such as type 2 diabetes mellitus, hypertension, and lipid profile changes. And that's it.